Dr. Michelle Teo is a community rheumatologist here in Penticton. She and her team have spent 10 years researching how to incorporate team-based care in medical clinics. As a result of the incredible success of her work, she has dedicated her career to make team-based care a widely available option for physicians so that patients can have improved access to high-quality care. She's also a former board member of the Doctors of BC. Dr. Teo, can you hear me?
I sure can, Nora.
Oh, that's so great. I'm so glad. We've been messing about with some technology here in the studio trying to get everything organized. So it's really great that it worked out. And I'm so glad that you could join us today. I know that you have a great story to tell. I'm excited to hear it. I'm just going to give you the floor and let you tell your story. And then if I've got questions, I want to fill in some gaps, we'll take it from there. How does that sound?
That sounds perfect. And thank you very much, Nora, for the opportunity to speak something that is so incredibly near and dear to my heart. So as you said, I am a rheumatologist in Penticton, but as many people in Penticton know, I'm no longer practicing because I have dedicated my career to empowering frontline healthcare workers so that they can provide high quality patient care to more patients in a sustainable way. It's important to understand the journey that got us here and the exciting future of what healthcare holds. So when I started rheumatology, I came, and many of your listeners may know of and remember a fantastic rheumatologist, Dr. Bob Offer. He was a gentleman. He had a 39-year-old practice, and I inherited it in 2013 when my family and I moved to Penticton. He had 700 patients. I could not care for those 700 patients by myself, let alone see the new patients that desperately needed rheumatology care, not only from Penticton, but the surrounding areas, including the Kootenays. So I quickly had to figure out another way to do things. And that's when my first nurse, his name is Joel, and we started working together to understand how can we as a team work together where, as the doctor, I'm still responsible for providing care and seeing every patient, but how can he support me in providing that patient care and also be a part of it? Because as a nurse, I mean, he has incredible skill sets to offer patients, which I most certainly am not very skilled in. We did that for a few years where I was really trying to understand things. And when we really got good, I said, well, are we just going to stop here? Or are we going to try and add more nurses and see what we're able to achieve? Because you and your listeners know just how incredibly underserved we are in the Okanagan, actually, east of Surrey. So at my peak, I had 4 full-time nurses, 2 part-time nurses, and 2 secretaries helping me care for a practice that was over 3,000 patients. Where I was responsible for every single one of them. But as I said, I had incredible support from a phenomenal team. There were a few other reasons prior to this project that I would love to be able to talk to you about that made me desperate to understand this team-based care. One, I've been a victim of burnout, physician burnout, healthcare worker burnout. We hear it all the time. And it's not because people don't care to help people anymore. It's because they just can't sustain the status quo. And so much of our time is not so much caring for patients, but it's the burdens, administrative burdens, it's paperwork, it's jumping through hoops. And that is what is sucking us dry of our joy to be in healthcare. So I knew that I had to find a way where I protected my energy. At the same time, over the first 5 years when we were learning this model of care, my mother and my own daughter, my eldest daughter, developed rheumatologic conditions. I'd like to speak about my daughter's experience in particular. She has a very rare form of juvenile arthritis. And thinking I was a very, very good rheumatologist, and absolutely I could empathize with the patients and where they were coming from because I'm a nice person. I had no idea the vulnerability and the helplessness that patients and their loved ones experience when they're on the other side of that therapeutic relationship. And I quickly learned that I had to find a way where not only are healthcare workers able to preserve their energy to do what they truly went into healthcare to do, which at the end of the day, help patients, not fill out paperwork and do banging your head against a wall type of activities, but patient care could not suffer because that vulnerability I felt, the 500 patients that were sitting on my wait list and their loved ones, they were feeling the exact same thing. That's what really motivated us to not only find a model, but try to get it into the hands as many physicians and healthcare professionals as possible. In 2022, that is when a joint committee of the Ministry of Health and the Doctors of BC, it's called the Specialist Services Committee. This is responsible for being involved with specialist-related issues. They said, well, you know what, Michelle, you have increased your patients by over 3 times. Let's see if you are able to apply that to different specialties in the outpatient setting using the exact same principles. The doctor sees everybody. The doctor is responsible for the hiring and the managing of the employees. And that's what we did. And we took 9 different specialties, including surgery, and we mentored them, we taught them. Very different from other healthcare initiatives, which are quite top down, where people tell you this is how it's going to be and you're just going to do it. This is different. This was, I mean, think about it. If you want to learn to drive a car, would you ever dream of learning to drive a car from someone who's actually never driven a car? They may have memorized the textbook, but they don't have that experience behind them. Never, right? We would expect to see people's experience before we let our loved ones learn from these individuals or ourselves. The same thing here. So much in healthcare is directed by individuals that are doing their best. I do not doubt for a minute people are not trying to do their best, but they may not a lot of time they don't understand the realities of the people on the ground, which is why there is such a big disconnect between what people say up top and what actually is achievable on the ground. This program called Specialist Team Care takes that and flips it on its head. It takes people who have succeeded in team-based care in this outpatient model, and so what me and my team were able to do. And the doctor mentors the doctor. My nurses mentor their nurses and their allied health professionals. My medical office assistants mentor their medical office assistants. And together, I mean, we don't solve their problems, but what we do is we are able to really understand what is going on and support them so that they can find the right solution for their specialty, for their patients, and for their community. As a result of that approach, within 6 months, the average patient increase for these specialist teams was 100%. And it's sustainable. So many of these teams are excited about expanding it further. So that is the really exciting healthcare reform that's taking place in BC. And I am so desperate, as I've said before, to get this into the hands of as many physicians and their teams as possible to teach them so that they can mentor and coach their peers. Because as a rheumatologist and her team, if we can teach a pediatrician, orthopedic surgeon, an obstetrician gynecologist, a cardiologist, if we can teach these type of specialties how to increase their patient capacity to a place where within 3 months there is significant improvement, can you imagine what and how effectively and efficiently a cardiologist could teach a cardiologist, or a dermatologist teach their dermatology peers? So I have launched this campaign called Better Care for BC. The website is bettercareforbc.ca. The reason for this is because I submitted a proposal to the provincial government, asking them to fund a 2-year proposal that would allow us to further learn from a total of 100 more specialists, and this one would include family medicine as well, how refine each of these specialties. So every 6 months, there would be 25 specialty teams that would be trained. At the end of 2 years, not only would we have 100 specialists who are champions in this, and we will have a much clearer and precise way to support each of these specialties and communities. Because you and I can agree, caring for patients in the Okanagan is not the same as it is in downtown Vancouver. There are challenges on both ends for both patients. But we will also build a framework so that hundreds, if not thousands, of doctors could be trained per year. And this could be the new standard for outpatient-based healthcare. It's super exciting. And I sincerely hope that the government will decide to go ahead with it. But, we've had examples when the government hasn't really wanted to be right front and center with innovative work. Electronic medical records is one example. The reason EMRs don't talk together, the provincial government doesn't have any data on all different physician clinics, is because they allow that to happen by itself. And doctors have just done it on their own. I hope it'll be different this time around, this outpatient-based healthcare reform. But if they decide not to, then we will most certainly have an opportunity to do it with private businesses that will be the champions for reforming universal outpatient-based healthcare.
Wow. Well, I love your enthusiasm, and I also know how hard change is to make happen. It's like moving a mountain, but it sounds like you've got things rolling a little bit. Now, you talk a little bit about the different specialties. So far, what are some of the specialty areas that you've been able to offer the training and the support to for them to start to change the processes that they use?
Absolutely. And that's a really good question, because it is important. And again, this shows you how not top down this is. We have to honor and respect the needs of the specialty as well as the patient needs within each of those specialties. And so we have 4 different surgeons or of 3 different surgical specialties. Now, I need to just remind your listeners, waitlist when it comes to surgery, that's a different kettle of fish because that is dependent on operating room time and the hospital resources. So that's a real tough one. What the access to patient care that I am referring to is how long you sit on a wait list before you're able to see your doctor in their clinic, either in consultation or in follow-up. So we have had urology, obstetrician gynecology. We have 2 of them. And I just like to say they're the 2 happiest one in the province, because obstetrician gynecology is a really challenging specialty right now. And yet they say that the reason that they are able to still enjoy their career is because of what STC has been, the relief STC has been able to offer them. And that reminder for the reason we went into medicine to begin with. And we also have orthopedic surgery. And then in the medical side, we have cardiology, we have dermatology, we have a general internist that specializes in weight loss medicine. We have a pediatrician. I have to do a shout out for her because her and her team have done just remarkable work. She specifically wanted to look at the wait lists associated with children who have been referred for autism spectrum disorder conditions, as well as youth mental health. We know what a big issue this is right now. And so many children are waiting over half their lives on a wait list to be able to be seen by someone like her. She has been able to increase her patient capacity and reduce her wait lists by over 300%. It is absolutely phenomenal, the incredible work that she has done. And really, I mean, she's done lots of other great things, but it is what she has been able to do and how quickly she's been able to see these children when it is so important to see them as quickly as possible so that interventions can be as effective as possible. That is what she and her team are so proud of. It's really remarkable. We have a respirologist. We have a gastroenterologist as well. And all these specialties are all throughout BC and all of the health regions.
So are you now looking to have those people that you've trained go on to train their colleagues within their own specialty to extend and expand this process to more and more practices?
With specialist team care in particular, there is still a lot of work that needs to be done. And again, I put this scenario out for your listeners. The first time you did something, probably, wasn't so great. And the more you did it, the more you practiced, the better you got. That is what we are requesting for those next 2 years. This was a very successful, but I believe it can be so much better first attempt at transferring what we've learned in my clinic to other specialties. What we need is to get more experience under our belt, because these people and these incredible physicians and their teams and the accomplishments that they have achieved, this was purely with a proof of concept. Does Dr. Teo's model apply to them? We didn't do any leadership training. We didn't prepare them for any mentorship to replace me. Absolutely, the goal is for there to be champions within each and multiple champions within each of the specialties. So these next 2 years that we desperately need before we can really feel that you have a well-greased and oiled machine, we have to get more experience. We have to get more data, get more people from the specialties over the next, like I said, within 6-month cohorts. And over that time, also develop a process so that we can empower them and support them so that they can replace me and my team on the ground. And like I said, I mean, it will spread like wildfire. I mean, for example, in rheumatology, there's less than 100 of us in all of British Columbia. You have a few champions. I mean, we only need to teach and mentor 100 people. I mean, it will, and it's rheumatology specific. It will snowball, and the benefit will happen very, very quickly.
So do you think that once this model is the norm, which is what the goal is, right, to make a new norm for how specialist care happens, do you think that we might actually see some change in how our family practice practitioners will act in terms of giving those referrals to people? Because, if you don't think your patient's going to be seen for a long time, you might try and manage it on your own. And maybe you just want to have them seen and then maybe get a little bit of feedback so you can continue their care. I just wonder, is that sort of one of the goals you have for this program?
So Nora, I mean, if you didn't think it was possible, I'm about to show you it is. I'm about to get even more excited because now let's talk about what this will lead for healthcare. If we are able to double the number of patients that every doctor is able to see because they're supported, the doctors will never go back to their old way of doing things. They no longer are sucked dry of their evenings and weekends by doing administrative work, and they can be who they want to be with who they want to be during their spare time outside the clinic. And they are supported by an incredible team where there is the synergy and shared vision to deliver high quality patient care. If every doctor was able to double the number of patients, we would have enough doctors in British Columbia. And your listeners have heard multiple times how quickly this can happen. Per doctor, it can happen as quickly as in 6 months. Now, Once we are able to get patients the care that they deserve, and for the healthcare practitioners to be working in an environment that is sustainable and fair, we will be able to move from a reactive healthcare to now a more proactive healthcare. And now it's no longer, you're not bad enough to see a doctor, because that's where it is right now. And I know so you and so many of your listeners can empathize with this. I mean, I can too. It is now, it is unusual, or the doctor will no longer be so exhausted, and the team is also there to support the doctor, where if there's these little warning signs of something not being right, now we can jump on it. We can start providing care as soon as we see evidence of healthy not being healthy. That is the most effective healthcare, preventative healthcare. And that truly is what keeps me going for this future state, which I truly, deep down in my heart, believe is possible.
So we would be able to get our patients to be seen by the best physician in the fastest time and get the best care that they possibly can, and at a time when that care is going to be the most meaningful.
Absolutely. Absolutely. And, and again, I haven't mentioned it. A big question I get from people is, well, if a doctor's seeing double the number of patients, I mean, aren't they feeling rushed, and like the patient feeling rushed, and you're on a conveyor belt? I should mention that the data from specialist team care showed that 90% of the patients were very satisfied with their care. So they felt heard. They are not rushed. And for your listeners also, I should mention team-based care is not just one way of practicing. It's an umbrella term for many different ways of how people in healthcare can work together to provide patient care. I'd like to use the example of many of your listeners may be familiar with going to the dentist. When you go see the dentist, you see the hygienist first, and the hygienist will do some cleaning, descaling, do some tests, do a quick look-see, and then relay information to the dentist, who then comes in and then is able to speak and talk to the patient about, okay, what's happening here. It's very similar that way. Again, it's different when we're talking about medical care, because patients are expected to talk. We're expected to build a good, therapeutic relationship with our doctor and their team. But even with the doctor being there less time than before, they still have an individual that is there, that is interested and caring about, their reason for being there, and who also acts as their advocate. They actually have more support than if they would be there by themselves. So that when the doctor does come in after the nurse, for example, and the patient have had time to talk, the doctor hears what needs all the medical mumbo jumbo stuff in a very short amount of time, because this team member knows exactly how the doctor needs to hear it. The doctor is now able to just direct the attention to the patient and talk about what the patient cares about. So, for example, in rheumatology, we need to know lots of stuff. How long is morning stiffness? How many anti-inflammatories are you taking? When was your last flare-up? All these things. But for me to ask those questions, sure. But instead, my patient would much rather me say, holy smokes, Nora, you're not able to go hiking anymore as a result of your inflammation. Like this, I assume, this is a problem for you. And this is a sign that we need to do things. And now we're able to spend that precious time together coming up with a plan. That is what patients find valuable, not the questioning that really doesn't get into how their health has been changed and how it's affected their lives.
So it sounds like the patient is getting to have a really connected interaction with the nurse or other allied healthcare provider, and able to, share the stories that they want to tell, because that's all part of telling you about what's going on. But then the transition of that information to you is practitioner to practitioner, and sort of is a little bit more direct and concise, so that you're able to get the specific information you need. And then when you interact with the patient, they've already had a really wonderful interaction, and now they get to see you and your smiling face and your compassion, and receive that care, get a care plan in place for them. So they spend probably a lot more time talking to a healthcare provider in your clinic.
Oh, absolutely. But they are also my backup, because if, I'm hearing a story, something doesn't make sense. Someone has done all the questions that I know to the patient doesn't matter as much, but I need to know it. But, I'm able to fill in gaps if something's been missed or something doesn't make sense. However, I also, if I have missed something myself, I have a team member who says, "Oh, no, Michelle, you forgot that she said she's been on Advil full strength for the past 2 weeks and it's not working." And so it truly, it improves patient care and safety. And I have no problems with that at all. In fact, I feel more reassured, because now I feel it is less likely that unintentional error is to happen, because we've got people looking over each other's shoulders in a cooperative fashion.
We have 2 minutes left. So I'm going to say to you, is there a one message that you're dying to get out? And do we need to continue this conversation another day? Is there a point in time in which you're going to have some additional data, additional stories to tell me, and maybe then we can share them?
Absolutely. Yeah. So listeners, I need your help. This is a grassroots, bottom-up reform to healthcare. And I'm not going to lie, that some leaders may be a little irritated with me because I won't go away. But healthcare workers deserve this. Patients desperately deserve this. And this is the only way that we're going to get meaningful change. So I please ask you, go to bettercareforbc.ca. There is a button that you can push. It says "Take Action Now." Within less than 30 seconds, you can send our MLA and Minister Dix a letter saying that we need to spread specialist team care, this model that Nora and I have been speaking so much about. We need to spread this throughout BC so that as many physician teams and patients can benefit. And Nora, we've got a couple more weeks of hoping that the government will want to cooperate. But otherwise, as I said, I will be making this happen. I've dedicated my career to this, and I would love the opportunity to talk to you once we get it off the ground again, and to tell you how this made in Southern Okanagan healthcare reform is changing the lives of patients and healthcare workers.
So much good stuff comes out of Penticton, and it's why my show is called Penticton Rocks, because I got to tell you, this place really does rock. So thank you. We've got just a few seconds left, and I'm just going to say until next time, Dr. Teo, we'll keep the channels open and have some time in the future.
Wonderful. Thank you, Nora.
One moment. If I talk, what's going on in the background?
It's already turned us off.
Okay. All right. Okay. So, so now I can chat with you just for a short while. I have Craig Henderson here in the studio with me. We're going to do a few different sorts of recordings here before he heads back to Naramata. But it's interesting that the model you've described is one. When I was doing my Doctor of Pharmacy degree, I was in a cardiology clinic at the University of Alberta, and a team of nurses and pharmacists would go in and do that evaluation. It was such a rewarding experience as a practitioner to get to spend that kind of time with